All right, we're going to go ahead and get started. We would like to welcome you to today's webinar on burnout in healthcare. This webinar is part of the monthly North Carolina AHEC Practice Support Services Lunch and Learn. These webinars are held the last Wednesday of every month from 12 to 12:30. A quick reminder for everyone to please mute themselves. There will be designated times during and after today's webinar for questions and comments. For now, we will hand it off to Joy Thompson.
Thanks, Danielle. Can you hear me okay?
Yes.
Okay, so my name is Joy Thompson. I work with Wake AHEC in Raleigh, and I am going to talk about burnout in healthcare today. I'm going to talk a little bit about what burnout is, how it affects healthcare workers, and how it can be prevented. Burnout, something that you all have probably all heard about. It's something that's discussed often in healthcare organizations. But now I think it's even more timely because of the stress and upheaval that COVID-19 is causing. Burnout is something that's been, like I said, it's been discussed, it's been researched a lot, and it's just been kind of constantly a concern to researchers and healthcare organizations. As we all know, healthcare providers it's an exhausting profession. You know, people are expected to perform patient care. They're expected to have lots of patience and empathy, all while working in a sometimes highly stressful environment, sometimes with few resources and with excessive workload. So I think burnout's important. The research is showing that the prevalence of burnout is rising. And one of the biggest points of concern is that it can lead to lower patient safety and lower patient quality of care. Most of the research that I looked at is for physicians and nurses, but this is within healthcare. This isn't just a physician and a nurse problem. It can affect all different occupations. So I think everything that I'm going to talk about today can be applied to, throughout to different positions. Okay, next slide. So, what exactly is burnout? The World Health Organization has defined burnout as a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. The term burnout is used a lot, so some people might think it's kind of a synonym for workaholism or laziness or boredom or something like that. But this definition that the World Health Organization has come out with pretty much sums up what we think of as burnout in healthcare. So burnout, the term burnout was kind of first used by a psychologist named Herbert Freudenberger. He was volunteering at a free clinic in the East Village of New York City during the 70s, and he kind of observed this syndrome amongst his fellow volunteers. He saw as the volunteers started to appear exhausted from the demands on their energy and resources from working in the free clinic. The volunteers, they became tired, frustrated, more and more cynical, started complaining of headaches, colds, GI issues, sleeplessness. And then as it kind of went on, they were easy to anger, suspicious, cynical about, the patients, the clients, and the other staff. He also observed that as the volunteers began to seem burnout, people started to spend more and more time at the clinic, kind of working, but they were really accomplishing less and less. They were getting more involved in the patient's issues, more involved in the clinic's issues, and less involved in their own personal lives and having like an outside social life. So he observed this happening, and decided to use this term burnout to kind of describe the situation. So, and then in the 80s, following Freudenberg, another psychologist named Christina Maslach, she started researching burnout, and her research was really kind of a kickoff to burnout becoming an issue that researchers were interested in, and healthcare organizations, human services organizations, education, um, that they were interested in. She defined burnout as a physical and emotional fatigue that results in a decrease or loss of motivation for work that can evolve into total exhaustion and a sense of failure. She kind of defined three main parameters that make up this burnout: emotional exhaustion, which is, more than just a fatigue. It's just when a person's emotional resources are depleted and they feel like they have nothing else to give, kind of on a psychological level. Depersonalization, a person having negative, cynical attitudes, cynical feelings, negative feelings about the patients, even that sometimes can lead to a, a kind of callous view that the patients kind of deserve what's happening to them, their troubles and their issues. And a reduced personal accomplishment, which is, workers evaluating themselves negatively, feeling unhappy about themselves, feeling unhappy and dissatisfied with their accomplishments at work. So burnout is all three of these parameters, all three of these factors. It's not just depression, as Maslach says, that burnout is a step on the path towards depression. But some people say, oh, it's just depression, it's just clinical depression. But researchers argue that this is something, this is something different, that this is something that has to do with your job and your workplace. So burnout's kind of like a red flag. It's a warning sign that other things need to be addressed. It's, common, chronic, everyday stressors that most of us just kind of handle and deal with. They become unbearable. So Maslach created something called the Maslach Burnout Inventory, also known as MBI. To measure burnout, and it's something that's still widely used today. It's something that if in your practices you wanted to measure the level of burnout that your staff is under, you can find Maslach's burnout inventory and use that. So why should we care about burnout? I mean, of course, we care about anything that is making our coworkers, our fellow humans upset. But physicians have, the research shows that physicians have the highest rate of suicide of any profession. This group, there's a group called the Physicians Foundation. They work with the AMA, and I know they work with North Carolina medical societies, some medical societies in different states. And so they did a survey this summer in August and compiled all the results and had them ready and released them in September. Their survey found that 58% of physicians reported often having feelings of burnout, and this is up compared to 40% from their survey in 2018. They found that about 22% of physicians, almost 1 in 4, know a physician who's committed suicide. Literature shows that the relative risk for suicide for physicians is higher than for the general population. And then even when you split physicians into male and female, the risk for female physicians is higher than for male physicians. So burnout's not only detrimental to healthcare workers, but obviously also to the patients. There's been research that shows that surgeons that have a higher degree of burnout are also having more major medical errors. There's research about nurses that as nurses felt a higher level of burnout, their patients had a higher rate of death and a higher rate of hospital transmitted infections. And there's also been several studies of medical students and residents that's shown that burnout is linked to them having, behaving dishonest behavior, alcohol abuse, a decreased sense of altruism. Some other interesting things from the Physicians Foundation survey, 50% of the physicians they surveyed said that they were experiencing inappropriate anger, tearfulness, or anxiety as a result of COVID-19's effects on their practice. And 78% of physicians rated a lack of the population's compliance with COVID-19 distancing and mask wearing protocols as their number one source of frustration during the pandemic. Some of the signs of burnout are, I've got them listed on this slide. Exhaustion, so it's some of the things that, that Freudenberger observed and that Maslach talked about. Exhaustion, an emotional exhaustion that can also have physical symptoms, headaches, stomach aches, appetite and sleep changes, isolation. People with burnout tend to feel overwhelmed, so they isolate themselves. Escape fantasies, not only just kind of wanting to maybe quit your job or run away or something, but also using drugs and alcohol to kind of numb the pain. Irritability, being snappy with coworkers, friends, patients, and also frequent illnesses, because, we all know that any long-term stress is going to kind of lower your immune system and cause frequent illnesses. So my next couple of slides are the 12 stages of burnout. These first four are excessive drive, ambition, we start a new job or a new project on the job or something like that and have a lot of drive and ambition to work on it, and then pushing yourself to work harder. That ambition pushes you to work harder, which then can push a person to neglect their own needs, to kind of start sacrificing things like sleep, exercise, a good diet. Displacement conflict, as the person is getting more stressed out, blaming other people, blaming the boss, blaming colleagues, if my coworkers weren't slacking, then I wouldn't have to do all this, displacement conflict. Feeling like there's no time for non-work related needs, so starting to withdraw from family and friends. Things that used to be enjoyable, you feel like I don't have time for that anymore. Denial, denying that all of this is taking place. Being impatient with the people, being impatient with the people around you. Withdrawal, again, kind of goes along with the no time for non-work related needs, with further withdrawing from family and friends and social activities that that a person used to enjoy and participate in, now not doing those anymore. Having behavioral changes. On the road to burnout, a person might become more aggressive and, snap at their loved ones, their coworkers for no reason. Depersonalization, feeling detached from life and feeling that you don't have the ability to control your own life anymore. And next is inner emptiness or anxiety, feeling empty or anxious. At this point, some people might turn to thrill-seeking activities, thrill-seeking behaviors, and also things like substance abuse, gambling, overeating. Next is depression. Life kind of starts to lose its meaning, and you start to kind of feel hopeless. And then the last step, right, the step that we don't want anybody to get to is a mental or physical collapse. At this point, right, somebody at this point is going to need a mental health and medical attention, probably. So there is this idea of job person fit. It's the idea that you can look at these 6 areas, and it helps to indicate how well a person and the job conditions kind of fit or match or are in balance. More negative, more negative reactions in this area can mean that there's a higher chance for burnout, and more positive can mean that a person is just really engaged in their job. So workload is the amount of work that a person perceives that they have, right? Because workload and exhaustion can be linked. Control is the control over the work environment. So control over the schedule, having a work-life balance, having an appropriate level of autonomy for that position. A lack of control can cause a mismatch. Reward includes salary, benefits, but it can also include positive feedback, staff recognition. In terms of reward, in terms of like positive feedback and staff recognition, having public recognition is important. Community, the community is kind of the work community, so coworkers, patients, their families, that type of thing. The community is really important because it can be a great source of protection from burnout if it's good and positive, but it can also be it can have a big negative impact when the community is not positive, when there's a lack of support, a feeling of distrust, a lot of competitiveness, unresolved conflict, and just a socially toxic work environment. And then fairness is, right, like how fair people feel the workplace is, if they feel like rules and policies are applied to everybody equally. And values is the meaning that we find in our work, feeling proud of our work and feeling like the work is making a difference. The tendency with burnout is for people to try to fix the individual, but the workplace has to have some accountability also. Helping people cope with stressors does not change the situation that's causing the problem. So some causes of clinician burnout through surveys and through research. We've narrowed down a lot of causes of clinician burnout. Some of them are short visits, complicated patients, feeling like there's a lack of control. The electronic health records can be stressful, and a poor work-life balance. I borrowed this kind of infographic from the Agency for Healthcare Research and Quality, AHRQ. They've been doing research for over 20 years, researching working conditions for healthcare professionals and their ability to keep patients safe while also providing a high quality of care. So some of their projects, some of the projects that they have funded have found that half of primary care physicians feel stressed because of time pressures. More than half felt pressures time pressures when conducting physical exams. They felt like they needed more time for follow-up appointments. The studies have found that the EHRs did not necessarily reduce stress. The use of EHRs for shorter visits was associated with increased physician stress. Some of the other work conditions that cause clinician burnout, let's see, are like time pressure, like I've talked about, a chaotic environment, low control over the work pace, an unfavorable organizational culture. Fortunately, researchers found that these work conditions were not consistently associated with a lowered quality of patient care, but sometimes they were. The COVID-19 crisis, you know, the demands and stresses on physicians, nurses, and all healthcare staff have increased. So this is a great time to kind of, in your own practice, in your own offices, try to look at this and see what you can do about it. So, of course, in research, when they've looked at causes, they've also looked at promising interventions. And basically, a lot of them are just the opposite of the cause. Flexible schedule, having more time built into the day, more time to do certain activities, a decreased workload, improved schedules, optimizing the EHR, making sure, you know, we're using it to the best of its ability, also getting providers some help with EHR entry, mindfulness. Doctors do better in organizations. Researchers found that doctors do better in organizations where they are not compensated for individual productivity. Being compensated for individual productivity was something that was highly correlated to burnout. Doctors do better in organizations where they're not under as much time stress, where they have more control over clinical issues, and when they're able to better balance family life and work life. So there's a need for effective strategies and tools for the individual, but also for the organizations, for the institutions that the individuals work at. Because like I said earlier, burnout is considered a workplace issue, right? So there are things that we as individuals can do to prevent burnout. But even this list of 6 things that I have right here, organizations can also, you know, change things and do things to help these also, right? I can work on this myself, but the company that I work for can help me with it. So nutrition, and these are just, right, they're basic things that help relieve stress in general. Eating healthy, right? Eating healthy food, making sure to eat at all, and making sure not to overeat. So organizations can make sure that there are healthy food options in the cafeteria or in the snack machines, and that everybody has like a scheduled time to eat, that people aren't having to skip meals because the schedule is so jam-packed. Fitness, making sure, you know, we can all individually make sure that we get exercise and try to stay physically fit, but also the organizations can, you know, try to have subsidize a gym membership or have an exercise room in the office in the location. Emotional health, right? Relaxing, re-energizing. We can all do that on our own, but work can definitely, organizations can definitely try to facilitate that in their staff. Preventative care, going and making sure that you get all your preventative care visits done. You know, leadership can help and to make sure that people occasionally have some time off for personal meetings, doctor's appointments, things like that. Having a culture where people feel like they can take the time off to go do these things. Financial health, right? Financial health definitely lessens stress. And so companies can bring in financial counselors, bring in people to talk about retirement, help with retirement planning, things like that. You know, meditation, yoga, these all help with like mindset and behavior adaptability. Research has shown that resilience can be taught and developed and strengthened through coping skills training. So that's something we can all kind of look into and try on our own, but it's also something that companies can help their employees with. So how to prevent burnout. So like I said earlier, the focus can't just be on the individual. It has to be on the, you know, within the organization also. There are lots of steps organizations can take to prevent burnout and help staff. A lot of them are, right, some of the things that I've already mentioned, trying to create more time in the schedule for people to do admin work, maybe try to have more time for the different types of appointments, follow-up appointments, physical appointments, encouraging work-life balance or work-home balance, providing assistance to providers with EHR entry, looking at the productivity-based compensation, allowing flexible schedules, doing staff surveys. You know, surveys can be done all kinds of ways. They can be done at a high organizational level, right, with HR and organizational development. They can be done within a department. In my research, I found that the most important thing about a survey is that if you're going to use them, you need to take some kind of action from the survey, right? Or people start to feel like we just do these surveys and nothing ever changes. Nobody's paying attention to them. And the culture can't be that people are scared to be honest in the survey, or that they feel ashamed about answering honestly. Any prevention needs to involve leadership and peer support. Providers, you know, physicians like to hear about these things from other physicians. Nurses like to hear about this from other nurses. So, right, having a peer talk to staff about, having a peer physician talk to physicians about their experience with burnout and what they went through and how they, you know, got better. Increasing interaction amongst physicians, increasing interaction amongst staff. Starting to address burnout early. So in school, medical school, nursing school, you know, when staff first starts as a part of onboarding, new staff, you know, start talking about burnout early and decide what success is going to look like ultimately. Success can't be, you know, we want to lower our burnout survey scores, right? Something has to be changed. The chronic stressors that are causing burnout, that's what needs to be changed. So a great place to start, a kind of easy place to start, is just the 6 areas of the job person fit that I talked about earlier. Right, just looking at those and starting there is an easy place to start. This my last slide here includes some resources that you might be interested in. Like I mentioned earlier, Maslach's burnout inventory is still, she created it in the 80s and it's still being used today. Dr. Maslach is still going around and doing interviews, doing presentations, things like that. So I've got a couple resources up here that I've looked at and that were mentioned in research that I read that can be resources if you're interested in working towards some improvement in your own practices. And then my very last slide is just my references. I think I'm right at time. Thank you. I hope I hope you guys found this interesting and kind of got something out of it. And I hope everybody has a great Wednesday afternoon, a great week, and take care of yourselves.